Good morning, I'm Dr. Hart, and welcome to a day in the life of a Pleasant Valley veterinarian. You guys today are going to follow me through just a typical day here at Pleasant Valley. In the mornings we usually do our procedures, so this morning you'll follow us through surgery, so we'll be doing some space and some non-routine procedures. We'll also work on dentals as well. You might see that at some other time. And then typically later in the day we will go through just our routine appointments in the afternoon. But let's go through our surgeries this morning. So typically what we'll do in the morning for surgery is bring all of our clients in with the pets to an exam room. We'll talk about the procedure, go over everything that they need to know. We'll do a full physical exam on all of our patients, and then our technicians will start drawing blood work and getting everyone ready for surgery. Looks cooler anyway. This is muffin. This one.
I need it, so.
Okay, so we're all done with our surgeries for the morning. So after we finish up, I will get on the phone. I'm gonna call all of my owners and let them know that everybody did well. We're gonna go over discharge instructions, get everyone scheduled to go home, and then we'll start working on our medical notes. Hey, it's Dr. Hart. How are you? Hey, good. Remington is all done. He did great. He's a good boy. Okay, so what you're about to see is just a typical appointment. So usually what we'll do is have the technician load the room. They will talk to the owner about what's going on with the pet, get the history, and then come back and tell me what's going on. And then the tech and I will discuss a little bit what we might want to do for the pet. We'll go in, we will do a full physical exam, and then talk to the owner about any tests, treatments that might need doing. So it just depends on what is going on with the pet at this point, and we'll kind of go from there. We'll let you see it.
I have Pepper. She's a 6.5-year-old spayed female cat, indoor and outdoor. Last year we saw her first time inappropriate urination. At that point we thought it was behavioral. It did stop on its own.
Okay, we never did a urine or anything.
No, we were not able to get a urine. Yesterday the owner noticed some urine in her wash basket.
Okay.
On the clothes there was a little bit of blood in it.
Okay.
She also noticed her going in the litter box frequently the past couple days.
Okay.
No crying, no changes with her poops, no vomiting. She's still eating normally, but she did notice a little bit of blood and the frequent urinations.
So, sorry to interrupt, she has litter box, uses it regularly when she's
Correct.
inside, but still goes outside.
It still goes outside too.
Okay.
She's a big hunter outside. She's
Okay.
on Revolution.
Great. Is
She
she up to date?
She is up to date, and she's also due for her vaccines in like 2 weeks.
Okay. Great.
So,
Is she a nice girl?
she is nice so far. I brought her back to get a urine sample.
Okay, perfect. Yeah, we'll see if we can
The
do
owner
that.
okayed that.
Okay, perfect. Sounds good. Sorry. Pepper?
Pepper.
All right. So this is Pepper. The owner did allow us to get a urine sample from her right away. So we're going to do our quick exam and then try to get some pee. Just make sure my microphone's on. Good girl. It's okay. Girl, I know. Okay, she can turn around and face you. There those lungs. Side. Okay, baby girl. Okay, baby girl. Oh, she's so tense. It's okay, sweetheart. It's okay. I know, Pepper. Hello, I'm Dr. Hart. Nice to meet you. She did really well back there. We did get urine. It did come out bloody. So we are seeing what you're seeing at home for sure. Otherwise, though, on physical exam, she does look really good. So our technician is running the urine now, so we'll see if there's, obviously, we'll see blood, but any signs of infection or crystals or anything like that. But she's indoor, outdoor. She uses the litter box when she's inside. I assume probably pees outside too. Yeah, okay, gotcha. I know she's had a history of a couple wounds just from being outdoors, but any other big major health issues for her? No? Okay. Okay, go right, little baby. Good. So, and then like I said, physical exam other than that, bladder looked great. So, if you're okay with it, we'll just see what the urine has to say and then come let you know. Okay? Lots of blood. Ooh, maybe it's true lights or... So a lot of the time during appointments, we do have to do a lot of multitasking. So while this urine is running for Pepper, I'm actually going to go see my next appointment, get a history, and then I'll check back with our technician when I have a second. Let me see here, the boy. I'm sorry. Come here, my guy, Bryce. He says, I don't want to. Good boy. I mean, he's got...
they've never been done? Like, they've never been put on their done?
They're not too bad. They're honestly not too bad. So I would maybe put it this way. Dr. Mike could talk to you about neutering him because he was a little worried about the one testicle. It might be better to say, let's prioritize the testicles and the neuter and then add on the dental since he's going to be under. So we're just looking at Pepper's urine. It does look like she has a lot of blood, some bacteria, and some crystals in her urine today. So definitely infection, and we are going to talk to the owner about what those crystals mean. So we will check back with you in a second. So this is Bryce's ear cytology that we took. We're going to take a look and see if he has an infection. Maybe you can even zoom in on the microscope and see what I'm seeing here. So we do a lot of cytology in-house here. We're going to be looking at aspirations of growths. We're going to look at skin impressions, looking for skin mites, all kinds of different things. So this is really the bread and butter for us here. All right, buddy. Which one did you say was bad, Emily? The left one. Okay, so I am seeing 2+ rods and 1+ cocci in the left, and occasional yeast as well. Poor guy. I might talk to Dad about culturing it just because he's a repeat offender. I don't know that we've ever done that before. We'll see how he feels about that. Okay. Okay, yeah, that's enough. Great. Thank you. We're gonna go back in with Bryce. Hello. Okay, Dad, so we do have an ear infection in that left ear again. Yeah, so again, this is what I see a lot with the allergies is we try to control them primarily. If we do a better job of that, we should hopefully keep infections at bay. Okay. So what I'll say is this, because he's a repeat offender though, if we come back in 2 weeks to recheck the ears and there's still bacteria present, or if they get inflamed and angry again in a few weeks or something, the next step for ears specifically would be a culture, because that could say, does he have a resistant infection that we need to be a little bit more targeted with our therapy? Good, yeah, hopefully it will. Exactly, yeah, yep.
Just saying that's even when it cleared up, it's still like his
looked real angry.
Hard to get.
Yeah, a lot of the time with more and more information, it'll kind of tighten down and scar a little bit. Yeah. So, yep, it'll narrow the ear canal a little bit. Yeah. So just keep that in mind. If we struggle to keep these under control, then we might want to culture the ear the next time an infection pops up. But otherwise, I'm going to have the girls come in. They'll do his nails. I'm okay doing vaccines, so we'll get that on board as well. Yeah. And then they'll go over the pills and the ear ointment. And then we'll see him back in about 2 weeks.
Oh, good.
Good? All right.
Yeah.
It was nice to meet you.
Right.
He's lovely, seriously. What a good
I
boy.
saw his little thing up there.
He's an ambassador
He's
for his
alert.
breed. He's a good boy.
He's a good boy.
Yeah, a certified good boy, right?
No,
Oh my goodness. I love you. Oh my gosh, we love lobster. Okay, sounds like she's doing really well.
She is,
Yeah?
yeah.
No
We
changes since last year?
No, well, she was here for my son brought her in because she was having like a bowel-stasis.
I see.
So
That was not with me.
I don't know who she saw.
Yeah, I didn't see that right there. Okay, but doing okay since?
Yeah, I mean, usually we catch it and we give her stuff.
Okay.
So we watch her all the time.
Okay.
I mean, I can always tell, and my husband's like, she's
Yeah.
not. I can tell there's something wrong with
Okay,
her.
don't take it lightly.
Yes,
Yes,
I'm like-
good. Always on guard.
Yeah.
Okay, beautiful girl. Hi, Loomis. Do you want to come out and see me? Hi. Okay, let's see how she feels about me. Pulling her out of there. Hi, love. Oh, you're so cute. Come here, baby. Hi, I know this. You peed in there.
She did on the way here.
There, little baby. Okay. All right, little nugget. Bunny burrito here. Face was torn. Okay, and then she's gonna get her vaccine. this year,
Yeah,
yes?
she got the last year, so
Excellent.
and it was said she was due for one.
Yeah, definitely keep it up to date. Okay, little one, let's take a look here. So we're gonna check out her eyes and her ears. Hi, Smushy. Please a good girl. Please brave. Okay, you're facing me here. I'll check out her teeth. All right, sweet girl. Now all the chompers. Very good. I am living in there. She's no. Clamp down tight. Come on, sweet girl. There you go. Good baby. Good. Good. Teeth look great. See the mini rabbit. Chewed up. Long pins all the way down. A little bit of wax, but that's normal for the loppy girls.
Okay.
All right, sweetheart, she can eyes. Listen to heart and lungs here. And unbraid you a little bit. Hi, sweetheart. Move back and listen to her gut sounds then. That's what we like to hear. Okay, sweetie. All right, let's see if she'll let me feel her belly. Sorry, kiddo. Now I'm ready. Wait more. She says, no, don't touch me. I'm so nervous. I'm so cute. I feel a nice full stomach. It's a sleep girl. It's good. All the American female. Okay, kiddo, last bit. We're gonna turn her over. I am so sorry. You take your tush, huh? A little dirty, but that's okay. Since I have had a bad day. and it's a little crusty.
Yeah.
Does she tolerate you holding her like this at
Yeah,
home?
not
No,
too much,
not at
no.
all. Okay, we'll clean her up.
Yeah.
I'll get back there for you.
She doesn't like that.
Okay, honey. I'm too scared to fight when I'm here, huh? She looks great. She looks really good. Okay, so we'll clean out her bum bum.
Okay.
We'll trim her nails. We'll give her her vaccine.
Okay.
Otherwise, she's good until next year.
Good.
Okay.
All right.
Awesome. Thank you.
Oh, no problem.
Right, she did great. She's perfect. Okay, so just about the vaccine, we mentioned this last year, but the only reaction sometimes they see is a little swelling at the injection.
Okay.
So just watch for that. And obviously, you know, signs of stasis, so just keep an eye out.
I brought it. Did I need to bring in her?
A fecal?
Yeah.
We can, yeah, absolutely.
I brought it.
Does she go outside like ever?
Never.
Okay. Then it's probably
Okay.
not necessary.
Okay.
Yeah, mostly if they touch the ground outside, then
She never.
absolutely. But okay, little girl. But yeah, she's all set. She did great. So she's all set till next year.
All right.
Okay.
Yeah.
Awesome. Thank you so much.
No, no
nice
problem.
to see you. See you later.
You
Thanks.
ready to go home?
So I hope you guys had fun in a day in the life of a veterinarian here at Pleasant Valley. We'll see you soon.